Hey everyone, what's up? It's Dr. David here from El Paso Manual Physical Therapy. Thanks so much for joining us live here on YouTube. We've got a great live stream today. We're going to be talking about the 4 reasons why doing the best exercises might actually cause more hip pain. This came off of a comment that we got on our channel here for a video titled top 5 tips to I'm gonna butcher it. Let me just get it right. It was about hip pain. Bone on bone hip pain is what it was for. And let me just pull it up here so I can read you the title. By the way, it's linked in the description below. You'll see that I've linked the comment, or I put the comment, I copied the comment that SummerBreeze gave us, the video that she got it off of, and then below that, just a little bit of information about today's topic, as well as a bunch of playlists that I'll be mentioning throughout this video today. So they're all in there. So the video came off of, where are we at? No, it's not in here anymore. I am having trouble finding it. So it's about bone on bone hip pain and 5 tips on how to help bone on bone hip pain. I'll leave it at that. It's in the comments below. I just can't see I can't see the description below this video right now. But I have the comment to read to you here, and it's from SummerBreeze. And before I read the comment, those of you that are joining us here live, let me know that you can hear me. Just type in the chat here that you can hear me. Say yes, I can hear you, and let me know where you're from as well. I see Beryl Wicker, Mel, Middleness, Tammy Higg, saying she's from Louisiana. Fantastic. And oh, Mel has a Canada flag. Very well. Beryl, I remember you from Tennessee. Thanks for joining us again, Beryl. Let me know where you're from. Right, then let's read this comment. So SummerBreeze is the username. He or she says, I follow these exercises for my hip, and now it really, really hurts. I had just occasional twinges in my left hip. In the 2 days that I used some of these butt stretches, I am now in real discomfort, bordering pain. I was wondering if it was just muscle pain, but I have no pain in my right hip. Any suggestions as to what happened? What should I do? So I love this comment. I thought it was fantastic because, we put exercises here on this channel, and those of you on here are probably, figuring out ways to help yourself with your specific problem, whether it's a hip problem, knee problem, back, neck, shoulder, whatever it might be. You might be searching the internet and you find some exercises that you think might be helpful, or you've seen other comments on there, especially if it's a video or a blog. And so it looks like it might fit you, or maybe you even had a friend or a family member, somebody that you trust, recommend some exercises from online to you, and you're thinking to yourself, it's hurting me, and how did it benefit them? Look at all these comments, look at this all these million views this person has, and likes and thumbs up and all that stuff, but it didn't work out for me. And so that's what this video is about. So I'm trying to answer, because SummerBreeze here, he or she probably just needs to tweak something, and then it will likely work for him or her. Great. I got a couple more comments on here. Beryl Wickle says, I got a shout out. Hey, Beryl. Jazzy Spirit. I remember Jazzy Spirit too, from New York, and Giovanni from England. Perfect and great channel. Thank you, Giovanni. I appreciate it. Thank you so much. We try hard in here. All right. So let's get into it. And just to remind you, as usual, ask questions on here. You can type in the chat here, and any question you have, whether it's about this topic or something else, I don't care. We'll get to it eventually. I do have to run out of here in about 20-25 minutes or so, and keep going with my day with patients. I'm looking at trying to get a consistent time for these lives, but it just has not worked out with the flow of my clinic, of our physical therapy practice. So as soon as I can, we will. But the one thing that is consistent is we can do this on Mondays. The time of day is variable. So let's get into it. The number one reason why you would get hip pain despite doing the best exercises is the technique, your exercise technique. The way that you do the exercise needs to be precise in order for you to fire the right muscles. This often is the biggest problem. And you might see somebody do an exercise. Like I have videos on here of me doing exercises. And if you just copy the motion that I'm doing, you may not fire the same muscles. That's why I take the time to explain on this channel exactly how to do an exercise. And one of the exercises that I believe I have on that video, I was going to show you, this is for you, SummerBreeze, is a bridge exercise. Pretty sure it's that video. But on that bridge exercise, you lie down on your back like this, and you're picking up your hips. So if you look at the video without any audio, it'll look like I'm doing this right here. But there's many ways to do this motion. And what I tell people to do on this exercise is first flatten your back so that you create pressure right here. Then squeeze your butt muscles. So those two steps have to happen first before you even lift. Once you flatten your back and you tighten your butt muscles, then you're allowed to lift. But if you can't figure out how to flatten your back and you're messing around with this, then this is going to be flawed from the get-go and it's going to cause you pain. And here's why, SummerBreeze, in case this was your problem, and those of you out there listening too, if you think of flattening your back, usually what that does is you see how my torso kind of moves, but some people don't flatten their back correctly. They'll flatten their back and inadvertently stick out their stomach or their chest just like this. And they feel muscles tightening up, but it's the wrong muscles. I've just actually arched my back, but I see people do this all the time where they arc their back, meaning to flatten their back, and they just can't get the motion down because they've never done this. They've never practiced this before. So when they go to flatten their back, they're doing this. And then if they go to tighten their butt and lift up, they're using their back muscles instead of their butt muscles. And it's just throwing the whole exercise off. And it's definitely going to create some sort of pain somewhere because it's just not the right way to do the exercise. I've seen this in walking too, like people comment on our walking videos on how to walk using your glutes. And you're supposed to feel like you're using your glute muscles, but if you feel like you're using your thigh muscles or the front of your hip muscles, or even your lower leg muscles, like you're in your calf and feet, way more than you feel like you're using your glutes, your butt muscles, then you're going to run into pain while walking. So that needs to be addressed as well. So that's number one is not having the correct exercise technique. I'm going to go into number two, and then I'll answer some comments here. And we have 4 total. Number 2 is co-contracting. So this kind of goes along with that exercise technique thing, like I said, but it's a little bit different in that if you're doing a bridge, for instance, what I want out of the bridge for somebody who's got hip pain or knee pain is to get as biased of a glute contraction as possible. And what I mean by biased is other muscles are going to inadvertently fire. That's just inevitable. We're expecting that, but we're trying to mitigate, we're trying to reduce how much other muscles fire and get the butt muscles to fire the best throughout that exercise. And so if you don't get your glutes to fire by themselves, or mostly the glutes, then you're going to be firing other muscles, which changes the forces at the hip joint and the knee joint too. And if you've got a hip problem like hip arthritis, or if it's really flared up, a labrum tear, hip tendinitis, hip bursitis, IT band syndrome is another common one. Any of those conditions, by the way, I've got videos specific to helping those conditions out and identifying if you have them or not. They're linked in the description below. If you just scroll down on this description, hit the see more button, and you'll see eventually a little lower a bunch of links for playlists to those problems. But any one of those hip problems, tendinitis, bursitis, arthritis, hip labrum tears, and IT band syndrome, all of those problems require you to use your glutes very well. And if you fire your glute muscles on, say, a bridge exercise or some other glute exercise, but if you think and tune in and feel what other muscles around your hip and thigh are firing, and if you suspect or you feel that the muscles on the front of your hip or the front of the thigh, let me show you, those are tightening up. So you do the bridge, you squeeze this, and you come up and you feel this tightening up right here on the front of both sides. Then you've co-contracted, meaning the back is firing and the front is firing. And that's not good, because what that does is it compresses the joint, it pulls the ball into the socket. And if you already got a flared up arthritic joint, or the labrum or something else in the area is flared up, is inflamed and swollen, then you're going to make it worse. Ideally, you want to only do this exercise to the intensity that you can just fire and control the right muscle group and avoid firing another muscle group at the same time. This happens all the time. There's a lot of reasons why this happens. Co-contraction is kind of a reflex that's developed in the body in order to get stability in a joint, and it's kind of a short-term solution. If you intensely squeeze anything enough, everything in the body starts to fire. I mean, just think of, like, if I were to pick up I have a weight right here. If you're to pick up this 25, 35 pound weight and just hold it for a while, eventually your whole body starts to shake. But if I'm holding it with my elbows bent like this, my bicep is going to be the muscle that gets the majority of work. But if I'm holding it for long enough, my triceps going to get tired, my other arm muscles are going to get tired, my grip muscles, my shoulder muscles, my back muscles, everything starts to work eventually the more intense an activity becomes. And that's how this is. If you're trying to work out a body part that's weak because it's in an imbalance and it's the weaker muscle, like with the glutes, the other muscles that are used to firing are going to jump in to help immediately. And so you have to really control how intense you tighten up your muscles and pay attention to your thigh muscles in the case of the bridge. You don't want those thigh muscles to fire, the front of the hip muscles to fire. You have to get just the glutes to work so that you're not co-contracting both sides of the hip. This happens in so many other body parts. We see this in the back all the time, and people are trying to work out their abdominal muscles, and inadvertently, by co-contracting, they fire their back muscles, which is not good. Then you cause compression through the spine. In the knee joint, you see people fire their lower leg muscles and their hamstrings, and it's just overdoing it. You have to work at the right intensities. So I hope that helps. Let's get into some questions and some comments here. We have a couple here. So, I missed Tess says hello from NorCal. What part of NorCal, Tess? I'm interested. Is it San Francisco, San Jose area? That's a fun place to visit. Beryl Wicker says, I have a bike, a treadmill, and a sauna in my lounge, and I get tired just looking at them. I'm sorry. Well, it's good that you're getting tired. Hopefully you get tired of using them. That's even better than just looking at them, Beryl. Tess says, is over 3 months physical therapy for lateral meniscus tear a long time for this type of injury? Ortho doctor suggests cortisone shot. What's the percentage of that to help the pain? Yeah, so I would question what you're doing in physical therapy, Tess, because 3 months is not abnormal for a meniscus tear. A meniscus does take a while to heal, anywhere from 6 to 12 months, really. So I think you're halfway through the shorter end of the estimation. But traditionally, physical therapy for meniscus injuries, whether it's like a fresh surgery, if you had a meniscus surgery, or even a non-surgical treatment of a meniscus tear, which is what I assume that you have, they overdo it. It's cartilage in there, that meniscus, and it needs to very gradually be loaded. If they're having you do a lot of weight-bearing exercise, like standing, walking, lifting weights, standing, anything where you're putting a lot of compression through that knee joint, or really standing or using your quads, strengthening your quads, the front of your thigh, those two activities are going to load your meniscus more and prevent you from healing as fast as you could. So you need to make sure that you're not using your quads too much. Even if you're not standing and walking a lot, if you're on a bike, for instance, or on an elliptical, another exercise that people commonly do is they use a total gym, like a machine that is angled and it has rails, and you slide up and down at an angle and you squat in it. So it's not your full body weight, but think about what muscles are working. If you feel that it's your quads primarily, then you're going to over strengthen your quads and compress your knee joints and not let your meniscus heal. The way the meniscus heals is you have to depressurize the joint so that there's less pressure on the meniscus, and you give it space and time to heal. The meniscus is designed to take forces, but if it's injured, it's not going to take forces normally. And you just give it some time, depressurize it, and it heals. And then once it's healed, then you begin to load it gradually, and you can tolerate more and more activity. So I hope that helps, Tess. Tess says she's from San Francisco. Visit Napa Valley. Oh, I would love to visit up there. I knew you were from some cool place, being from Northern California. All right, so let's keep going here. The third reason for doing the best exercises and still getting more hip pain, the third reason is joint irritation. So this is kind of related to the first two, but let me explain how it's different. If you began to do exercises and you're coming off having a ton of hip pain, and you're searching the internet for exercises, or maybe your doctor told you to go start doing exercises, or somehow, some way you got to doing exercises, but you were really flared up. I mean, like, it's hurt you to walk. You can't stand very long. Maybe you're limping because your hip hurts so much. You can guarantee that your hip joint is irritated. And even if you're doing the exercise correctly with the right form, and you're not co-contracting, you're not using other muscles inadvertently while trying to work out your glutes, for instance, the lining of the joint surfaces, the inside of the socket and the outside of the ball, might just be so irritated that no matter what you do right now, it's just going to hurt. And if you force exercise because it's a good exercise, it's the best exercise, in fact, it's still going to hurt. It's just not the right time for exercise. It's just like if you cut your skin and you have a fresh wound, you're not going to go put a bunch of pressure on it. You need to give it some space and let it heal. You need to just wait for that irritation to go down, let some healing happen. Then you can come back and start to do stuff to it once it's healed, once it's scarred down. Inside of a hip joint, a ball and socket joint, irritation starts to diminish, and you can tell that it's gotten better by how active you are. And that's when you just go rest. An injection might help you to feel a little bit better, but I would question if the tissues have actually healed. The number one thing, in my opinion, is unweighting yourself somehow by either just getting off your feet. And there's devices out there that you can use to unweight yourself. So like there's unloader devices that you can get in treadmills. Usually they're in physical therapy clinics, but some gyms have them. Doing water exercise, like where you're in water, walking in the pool, swimming. But that you also have to think, are you firing your quads too much? You got to make sure you're using your glutes. What I tell people here in the clinic, I don't have a pool here. We haven't had a need for one. We don't have an unloader device. We've been able to get away without using one. I just tell them to rest. Just go wait. Give it a week or two. If it's real bad, maybe a little bit more time. Let yourself feel better. There's some very easy, simple movement exercises that are not at all intense that you might do during that time just to increase or maintain your range of motion. Then once you feel better, now it's time to do the more intense exercises, like the bridges, the real good exercises that fire your glutes, maybe walking properly or some sort of hip thruster motion so that you can get your glutes really involved. We have tons of glute exercises here on this channel. Any one of those might be right at that time. But if you're just dealing with a flared up hip joint, don't do anything too intense right now. All right, number 4 here. This is the final one, and then we'll answer any questions that are left. Nerve irritation. This is a sneaky one that doctors aren't always keen on finding or thinking about. But you might have hip pain, worse hip pain, despite doing the right exercises, because your nerves are just angry and upset. And in the hip, there's tons of nerves that go all around the hip joint. So I've got my skeleton here, right here in the back, right there, the sciatic nerve comes out and it falls down right over the back of the ball and socket. There's the ball and socket. That sciatic nerve comes right over it. And so if your hip is hurting, you've had problems, it could be sciatica. It could be coming from the sciatic nerve. On the front, you've got the femoral nerve, the nerve that goes down into the thigh and innervates the thigh muscles. And both those nerves carry sensation of the muscles, the skin, all the area in here. And so you can detect pain from there. And so if those nerves are irritated and then you go do exercise, it's also going to irritate your nerve potentially. So you just have to be careful with how much you exercise. It might be as simple as not going up too high, because with nerve irritation, the harder you push in some directions, it could tension the nerve and be painful. And what I always tell patients that have this kind of pain with exercise, even though it's good exercise, is just go through the motion that you can. So going back to that bridge, if lifting up all the way makes it more painful, then just lift up a little bit, or maybe don't even lift at all, just squeeze the muscles, but staying down and work on that. And as the hip, the nerves around the hip go down in irritation, you should feel like you can come up more and come up better and get a better contraction, but you have to let those nerves calm down. Something else that will irritate nerves that people do all the time, and doctors and even physical therapists will tell their patients to do this, is stretching. They'll tell people to do like a figure four stretch, an aggressive stretch. They'll pull their knee into their chest and stretch it real hard like this. There's all kinds of stretches out there that in the moment might feel good because you do have tight muscles, and stretching it kind of opens it up and feels good. Your joint might be stiff, and moving it in a direction that it hasn't gone in a while might feel like you're making some progress. But if your nerve is also irritated on top of all those other factors, you're going to irritate your nerve and worsen your case overall. So if you're having worse symptoms like SummerBreeze might be having here, the person that commented and spurred on this whole topic, you might avoid stretching for a while. Do it for just a couple of days and see if you feel a little bit better. You might feel stiffer in some regards, but if you hurt less overall, then nerve irritation might be the root of your problem. And it's hard to find. It's hard to detect it because you can't really do a diagnostic test for it. There's some tests out there, but you have to have some serious nerve damage, chronic nerve damage, in order for it to show up. And oftentimes here in the clinic, we see people have nerve pain symptoms, but they're nowhere near coming out positive or having findings that are visible on a nerve test like an EMG or a nerve conduction study. That's where you have to go into a lab and they poke you with needles and they measure how well your nerves are connected to your body and the signal speed. Those tests are not always going to reveal that your nerves are irritated, but you might have pain for that reason. So a doctor might use a nerve medication as a diagnostic. They might give you like gabapentin, Lyrica is another one, to see if that helps your symptoms. Then that could be one way to determine it. But then you're taking medication, and some people don't want that. So that's the fourth reason why you might be doing the right exercise and still get some pain. All right, guys, I don't see any more comments coming through right now. I know it's a little earlier in the day. I think I usually catch people later on in the day. I just absolutely cannot today. My schedule is insane these days. So if nothing comes in here in the next few seconds, I'm going to wrap this up. And thank you so much for joining us here. Those of you that are here live, please give us a thumbs up if you haven't already. If you know somebody that needs to hear this, share the link with them so they can catch the replay and learn some great information. Thank you so much from the bottom of my heart. Thank you guys for watching. I'll catch you guys in the next video. Bye-bye.